Good morning, everyone. Good morning, and thank you so much, Amy, for that very generous introduction. I am so delighted to join you all, and I want to applaud Karen and her team here at the Colorado Health Foundation for prioritizing equity in behavioral health, realizing just how important this issue is. You know, I wanted to share with you, when you talk about behavioral health, you know, a lot of folks get really nervous about the topic, right? And I wanted to ask you, how many of you would consider yourselves behavioral health equity champions? Behavioral health champions, anybody? Wonderful. Usually when I ask that question, I don't even get one hand raised, right? People are so nervous still to admit that they actually are fighting on behalf of people with mental illnesses or substance use disorders. And as a matter of fact, 2 weeks ago, I was in a meeting where this wealthy benefactor who had created the STEM program for underserved children or underrepresented children said that for the first time ever in this program, she had 2 children. This is down in Miami, Florida, 2 children below the age of 8 who said, my goodness, I'm feeling like I want to commit suicide. They admitted to her that they were stressed out in this program. And I said, I wonder what she's going to do to address this issue, right? And she said, gosh, I need to do a better job screening the students that I let into this program. And I thought, oh my God, what does that mean? Here we have geniuses in every group, right? But to now cut off an opportunity to one group of students just because they've admitted that they had a mental health challenge, I thought that was unfair. So again, I'm very happy and excited that the Colorado Health Foundation, that all of you who have been pushing for behavioral health equity, that you all understand how far we have to go. We've come far, but we still have a lot of ways to go because this is an all too common struggle for many individuals. We have a lot to do to destigmatize the issue. So I thought I would start out in our discussion about the political determinants of health. I was really happy to hear Karen talk about power and privilege and the groups that lack this, talking about what we're doing to create health equity, right? The intention there. This is probably the most robust, bold effort I've ever seen in my life in terms of advancing the cause of health equity. And I wanted to start with this picture. So this is a picture that represents for me health equity. One that I have been fighting along with my other health equity champions for us to realize. Equity in health implies that everyone should have a fair opportunity to realize their optimal level of health. And what we're doing is fighting to get rid of those barriers, right? That leave many of these folks unable to achieve that. So imagine a world where instead of excluding individuals, we worked collaboratively to ensure that we help everyone to reach their optimal level of health. Unfortunately, this is our state of health affairs in health in America. Only a few people are able to achieve health equity, as you see represented in the middle. Other people are barely hanging on. 44 million Americans each year are diagnosed with a mental health issue or substance use disorder. Half of us in our lifetimes will be diagnosed with a mental illness, right? We know depression is going to be the leading cause of disability in the United States in the next 20 years. Then for those who actually have a mental health challenge, who have been battling this, the statistic is really sad. 350,000 people die prematurely each year because of mental illness. And if you have a serious mental illness, you die 25 years earlier than the general population. And that's a statistic that we were citing right before the ACA, back in 2008, 2009. 10 years later, that's still the truth, right? So how did we get here? Most of us are familiar with the mistreatment that many under-resourced, vulnerable, and marginalized groups have endured in our country in the name of science and medicine, in the name of economics and national security. But what many of us don't know or aren't familiar with is the struggle to advance the health equity agenda in law and policy. And so today, what I want to do is to highlight for you this lesser known story, right? We know there's been this larger movement to increase healthcare access, to improve quality. But underneath that movement has been a group of folks who have committed to really pushing the boundaries, making sure that we widen the safety net, stretch the umbrella a bit to include as many individuals as we surely can in terms of health access, improvement, quality, health equity, etc. So, at every stage of life, policy actions or inactions through a complex web of political structures have been created at federal, state, local levels and impacting our health status, right? Which are exacerbating health disparities. And I wanted to ask you all, how many of you know how long we have been fighting to advance the health equity agenda in policy? How many of you would be brave to venture a guess? What's that? Since the war on poverty. How many, who else has a guess? In the 1800s. Okay. Anybody else have a guess? 2006? Why 2006? It hasn't been that long? Well, would you be surprised to know that there have been health equity champions that have been pushing this agenda since the founding of our nation, right? So it was actually a trick question. A lot of people, when they hear me say, when they hear that I've written this book called 150 Years of Obamacare, they go immediately to, oh, 150 years? But that's not the case. We have been trying to push a health equity agenda for over 225 years. And here's the kicker. So Benjamin Franklin and a group of abolitionists, those who were mental health reformers, those who had been fighting for the rights of the homeless, etc., came together and they said, now that we've established this new Congress, let's push them to increase access to slaves, to people with mental illness, to people of all descriptions of life that have challenges, right, in terms of health. And Ben Franklin agreed to help. He had done it earlier, right, before the country had been formed in Pennsylvania, with the first hospital in Philadelphia. They were way ahead of their time. They had actually made the case for integrated care, right, in terms of mental health and physical health, looking at how behavioral health impacts our systemic health, right? And they actually were inclusive in terms of the patient population. African Americans and whites and other groups could come in. There was no segregated system, at least during the time when it was initially formed. And although Ben Franklin was a slave owner, as he matured, he also matured in his thinking and realized that the institution of slavery was a horrible, evil institution. And so he agreed to help these abolitionists to push the agenda. And he did so 3 months before he died, unfortunately. So in 1789, he got with a group of folks. They sent a letter to the Senate, to the House, saying, would you please consider giving access to health care for these vulnerable populations? And the Senate and the House quickly responded. So they looked at it, they reviewed the letter, and they actually, within 1 month, came up with this argument for, nope, we unfortunately don't have the constitutional authority to grant healthcare access to these groups. That's left to the states to do, right? And if the states want to do that, fine, let them do it. So after that, Ben Franklin died a month and a half later, right? And that was the first period in our nation's history when the light of health equity dimmed. It was the first real attempt at the federal level to push that health equity agenda. 75 years later, abolitionists, again, with mental health reformers and others, pushed another effort. And this time, they actually succeeded. So, why is the ACA such a big deal, right? How many of you remember on the day of the signing ceremony that Vice President Biden was caught whispering in the ear of President Obama? Do you guys remember that? Yes? Do you remember what he whispered? What did he whisper? It was a big expletive deal, right? And I actually argue that it's an even bigger deal than I believe Vice President Biden and President Obama recognized at the time. Because what we did this time around, taking cues from history, strategies and tactics that were employed, we brought together these disparate groups, right? Mental health reformers, minority health reformers, universal health reformers. When one group was on the losing side, another group was on the winning side. But guess what? Those wins were usually short-lived in policy. So why not bring these disparate groups now that had never before worked together, bring them together to advance this law, this health reform law, okay? So I don't know how many of you are history buffs or appreciate history, but I promise this is really interesting information. So after Ben Franklin died, so too did that effort to push within that new Congress a health equity agenda. 75 years later now, you had Dorothea Dix. Anybody know Dorothea Dix? You ever heard of that name?
Worked in her building in Tennessee.
Yes? Good. She's one of my heroes. So Dorothea Dix, with other mental health reformers, spent 40 years working to convince our lawmakers, working to convince Congress to pass a comprehensive mental health reform law. Dorothea went all around the country highlighting the abuses against people with mental illness. At the time, let me tell you, if you think it's a horrible time to live with a mental health issue today, imagine what it was like back then. Many folks were pushed out of their homes, became homeless. Oftentimes what happened, they were picked up, they were put in jails, they were stripped naked and chained and beaten. It was a horrible time to live with a mental illness. And Dorothea Dix and these mental health reformers spent 4 decades of their lives to go around the country to get the data, the information, develop reports highlighting these abuses, trying to convince lawmakers to do the right thing. And they finally succeeded in 1854, when they got Congress now to pass the bill for the benefit of the indigent insane. And you would have thought that that everything had aligned perfectly. The political winds, everything had aligned perfectly because you had a president at the time who should have been sensitive to mental health issues. Here's what happened. Anybody remember Franklin Pierce? Know that story? Franklin Pierce, a few months before his inauguration, he was on a train leaving a funeral with his wife and his only child. And on their way back from New Hampshire, the train crashed. It was a new invention at the time, right? But the only person to die that day was their son, their only child at the time. And it was a horrific accident. They saw his skull split open, there was blood everywhere. Mrs. Pierce was traumatized, so was our future president, right? She developed serious depression, anxiety for the rest of her life. The president became a substance misuser, he became an alcoholic, and he was just never the same after that incident. And yet, mental health reformers with Dorothea Dix and others believed that President Pierce would finally be the president to usher in a comprehensive mental health reform law. But instead of signing the law that had taken 4 decades to produce and pass, he vetoed it. And in one of the longest veto messages I've ever read, he basically set the federal policy of inaction in human welfare issues for the next almost 100 years in our country. So we had nothing going on, right, in terms of mental health reform, until President Truman comes into power. And President Truman tried to do, of course, comprehensive health reform, of course wanting to include mental health reforms, but he was unable to. So he had to do piecemeal legislation to create the National Institute on Mental Health, to study mental illness, substance use disorders, etc. After that, Eisenhower did something. President Eisenhower decided to convene a task force to study the gaps in our mental health system. Again, piecemeal. President Kennedy comes in, and he wants to push community mental health centers, right? And he gets that legislation passed. He was assassinated. President Johnson comes in and says, I'm going to fully fund this. And so they pushed the envelope. And then unfortunately, Nixon came in, and he decided to basically strip out all of the money that was left, negligible amount that was left for mental health. Well, 125 years to the date, another president attempted to do comprehensive mental health reform. President Jimmy Carter and his wife, who had been huge mental health champions in Georgia and had been trying and testing different pilot projects, and believed that what they had seen, the successes that they'd realized in Georgia, could be scaled up nationally. So 125 years to the date of President Pierce vetoing that bill for the benefit of the indigent insane, President Carter introduces his Mental Health Systems Act. And guess what? What do you think happened this time? What do you think happened?
Opposition.
No, it passed. It passed, and he signed it into law. The first time in our nation's history that we had a comprehensive mental health reform law passed. But guess what happened? This was done a month before the 1980 election. A month before. So what do you think the Reagan administration did? Did what? That's right. They prevented further implementation of that law and decided to dismantle what had already been implemented. It was one of the most disheartening episodes for mental health reformers. We again had come so close, and we lost that battle. And before anybody says that I'm bashing Reagan, I actually will be singing his praises in a second, so bear with me. So with that then, we decided, as we were working on the Mental Health Parity Act, a limited insurance reform statute to provide parity in benefits between medical and surgical benefits and behavioral health benefits, right? As we were working on that, many of us on the committee really wanted to push a comprehensive mental health reform law. But we knew that the political winds had not shifted enough for us to do that. And so we could not push that agenda. The insurance companies would have probably come after us. We agreed that we weren't going to mandate mental health benefits in this country. But we just knew that coming up with either John McCain, Hillary Clinton, or Barack Obama, all three saying that mental or health reform was going to be a priority, we just knew we'd have an opportunity to push that agenda for comprehensive mental health reform. So anyway, we took what we were not able to do in parity and in other laws, we decided to include as a template President Carter's bill, right? And we expounded upon them in the Affordable Care Act. So even for the mental health reforms alone, this makes the ACA a huge deal, right? 35 years later. So let me actually take you back again to the time when we had the first policy addressing the social determinants of health. So now, when I ask, how many of you remember or think you know when we actually had the first bill passed directly addressing the social determinants of health? The first major health reform law in America. That would be 1865, 150 years plus, right? We had the first law. So right after mental health reformers lost their battle, and interestingly enough, around that time was when the syringe needles were introduced into the United States, we had this crisis, opioid crisis in the country, right? And at that point, this happened right after the Civil War, many wounded soldiers, et cetera. There was an effort now, again, by abolitionists, by mental health reformers, by health equity champions during that time, to get Congress, as they are creating what we call the Freedmen's Bureau Act, to include not only these social determinants of health, right, addressing these social determinants of health in terms of employment and housing, clothing and food, et cetera, but to also prioritize health access. And what do you think happened this time around? They didn't want to do it in 1789. They didn't want to do it again in 1865. It was so contentious. That word health was so contentious. But yet they were amenable to including employment, they were amenable to education, housing, etc. But health was something that was stricken from that bill. And no matter how hard these health equity champions tried to reinsert that language, to get it over the passage, to get it passed, they just couldn't succeed. And so, thankfully, President Abraham Lincoln's folks, although he died, he was assassinated a few weeks after that bill was signed into law, his folks decided, well, you know what, we believe we have the authority to establish hospitals, to increase access based on the language in that bill. So even though it wasn't explicitly included, they found a way to get around it. And so they built hospitals for not only these freedmen, former slaves, but also refugees who were poor whites who were displaced as a result of the Civil War. And as a result of that, they were able to create a safety net that then actually helped us push the needle towards health equity afterwards. So after that, though, here's the clicker. So we didn't get mental health reform signed into law. We get this comprehensive health reform, this what I call the first social determinants of health law signed, but that only lasted 7 years. 7 years. And then opponents of that effort succeeded in dismantling the program completely. So imagine my fear then, right, in 2016, would Republicans actually dare dismantle the most comprehensive health reform law post-Reconstruction? Would they do that, right? And I'm going to show you why I wasn't as nervous as some other folks were. Actually, let me go back. In terms of universal health, I also wanted to raise this issue too, because every single time that there was an effort to push for universal health, opponents of this effort would try to infuse gender and race into the debates to undermine that effort. And unfortunately, that's what we have again, piecemeal. But here is what we've been doing over the last 35 years, right? There was an effort now in the late 70s, early 80s, by Margaret Heckler, under the Reagan administration. What Margaret Heckler, Secretary of Health, realized at that point was that while the overall health of the nation had been improving, the health of racial and ethnic minorities and other groups was alarming. And she decided to do something about it. But guess what? There were folks in the administration who said, Margaret, don't you dare touch that. Her own senior advisor said, don't touch this health disparities agenda. It's just way too contentious. But Margaret decided it was the right thing to do, and she pushed the Reagan administration to prioritize this effort, right? And they convened this task force. They looked at where the gaps were. They looked at where the crisis was. What could we then develop or create to address these issues, right? And so they worked on that, they got some stuff done, but it was never codified into law. And then the Bush administration comes in and says, you know what? We've got to codify many of these ideas that generated from the Reagan administration. And so for the very first time, they came out with the Disadvantaged Minority Health Improvement Act, right? And at the same time they did that, they also came out with Healthy People 2000. Anybody familiar with the Healthy People agenda? Yes? It's our nation's public health agenda, right? Over the next 10 years, we're going to try to meet certain benchmarks. And so what they did in 2000, in the 2000 version, was to say, we're going to include the language, reduce health disparities. And then folks said, no, don't do it, Secretary Sullivan. Don't do it, President Bush. That's, again, way too contentious. But they ignored that and said, we've got to do it. It's the right thing to do. Then in 2000, not to be outdone by the Bush administration, the Clinton administration comes in, and they said, you know what? We have these separate and unequal standards based on your race or ethnicity. That's unacceptable. We need to strive to reduce them across the board to zero, right? No matter your race or ethnicity, your sexual orientation status, whatever, we've got to make sure we're fighting to eliminate health disparities. And even though some folks will say, oh, it was a Democratic administration, of course they'd be amenable to eliminating health disparities. That's not the case. It took an external group of folks to put pressure on the administration and say that this is the right thing to do. And so they finally got that language in. And then in the next iteration of Healthy People 2020, under the Obama administration, they said not only are we going to fight to eliminate health disparities, but we're going to advance health equity, we're going to achieve health equity, and we're going to improve the health of all communities, right? Pretty robust. And what all three Healthy People agendas had in common was prioritizing behavioral health. And again, there were folks who didn't see the need to address that, but it was pretty radical at the time. So back in 2008, right after the election, the former First Lady, Rosalynn Carter, invited us to Atlanta. And she had this sense of urgency about her. She recognized an opportunity with the election of Barack Obama to push for children's mental health. And she wanted us to take advantage, to strategize, to create an advocacy group around the nation to push for children's mental health in this larger health reform effort. And she invited Marian Wright Edelman to come and to talk from her standpoint about what she had seen and what she thought was possible. And she said a new president or Congress is only going to be as good as the citizens outside demanding it. She didn't care who was in office. If we're not on the outside demanding it, it's not going to happen. So here's what we did. We looked at Dr. Martin Luther King Jr.'s basic steps for any nonviolent campaign. First, he says we've got to collect the facts to determine whether injustices exist. Then we've got to negotiate. Then we have to engage in self-purification, and then in direct action. So this is what we did. This was our strategy for pushing the Obama administration to prioritize health equity in the Affordable Care Act. We had basically 4 arguments that were made, again, based on the strategies and arguments that seem to have succeeded in the past. So first, we made a moral argument to the Obama administration, to members of Congress, that 83,000 racial and ethnic minorities are dying each year due to disparities in health. This is why you should focus on the issue. 350,000 premature deaths from mental illness, right? We know then that folks said, okay, we're sorry to hear that, sounds good. And it resonated somewhat. This moral argument resonated somewhat. And then the Tea Party movement started heating up. Then everything became about economics. And so folks said, well, you got to show us how your provisions then that you are pushing in this bill will help to drive down costs. And how much is the cost burden of disparities anyway? Of course, we didn't have any information on it. No studies had been done to put a dollar figure on the economic burden of health disparities in the country. And I want to salute you all here in Colorado because you helped to save the day for us. There was a research that was done looking at the cost of diabetes-related disparities. And we were at least able to use that report to say, well, here's what Colorado has seen in terms of the cost burden. Then we found another study, California, that looked at a few more variables. And collectively, we used this to stay at the table and push the agenda. Well, you can imagine if you're trying to advocate with different states, folks will say, that's Colorado, that's California, that's not us in Mississippi, right? Or Georgia, or wherever. So it only resonated for a short period of time. Then we made this national security argument because folks weren't listening to us anymore. And at that time, there were 600 generals and admirals who had convened and produced a report with the Department of Defense showing that 70% of young people, 17 to 24, that's 70%, were unfit for military service. They were extremely concerned at the increasing obesity rates. They were concerned with the increasing suicide rates, et cetera, among young people, the mental health issues that they had. They said, we have to do something about this. And we leveraged that report, and that's what helped us to get over that hurdle. And so we made the argument that these issues aren't isolated. They impact the social and economic vitality, because if folks are sicker and dying younger, they're not able to contribute to their communities. And they're not able to outcompete our global competitors or defend our country. And then we made a fourth argument, that policy in this country has been a driving force for many of the inequities that we have observed over the years. So why not use this policy vehicle to push this health equity agenda, right? We visited all three campaigns. All three said, yes, we support health equity, but the only one to put it in writing was Barack Obama's group. And so with this group that we convened, 35 initially with the former First Lady, Mrs. Carter, we then grew to 300 organizations. And as you can see, what an incredibly diverse group of folks who had never before come together in this unified fashion to produce legislation that would actually uplift health equity in this country. Folks from LGBT groups, racial and ethnic minority groups, women's groups, older adults, veterans, disability groups, faith groups, you name it, they came together and they said, this is the right thing to do, we want to push it. We came up with a strategy to push and bolster, and if you can tell, we were pretty persistent. At every step of the way, we did not take this for granted. We wanted to take every opportunity to push this agenda. So 2 things I want you to remember about this law. After hearing all this, it's the most comprehensive law addressing health issues impacting disparate groups, and it's the most inclusive law produced and passed by the U.S. Congress. And I've asked Congressman John Lewis, I've asked Ambassador Andrew Young, who worked with Martin Luther King Jr., I had asked others who have been in that civil rights movement, wouldn't you agree with me that this is the case? More so than the Voting Rights Act or the Civil Rights Act? Because, not only in terms of its content, but in terms of the people who were brought together to produce it. There were 5 health equity principles girding the ACA. We spent countless hours. In fact, we would stay till 3 in the mornings in our offices by the Senate, working on every single one of this language with this large group to get them to agree. And today, we have 62 provisions in the Affordable Care Act that address the disparities in mental illness, substance use disorders, racial and ethnic groups, LGBT, people with disability, which we're quite proud of. And our strategy was not to create one title on health equity, but to weave it in strategically just in case if opponents were successful in repealing a certain provision, they wouldn't come directly after all of them. Now, here's another big reason why it's a big deal, why the ACA is a big deal. So in traveling around the country, I hope you've gotten a sense of, from a mental health reform standpoint, how behavioral health makes this an even bigger deal than most people even recognize. But for all the women in the room, for all of those who have wives, who have girlfriends, who have significant others, who are women, I can't tell you how many times I've come up against men who have heckled me, who have screamed at me, saying, Why do I have to pay for maternity coverage? Why should I have to pay for maternity coverage? What would you say to a guy who says that? Why should we have to mandate maternity coverage as an essential health benefit? Because you were what? You were born, right? Well, here is why we put it in. The National Women's Law Center found that 90% of women in the individual market who thought they had maternity coverage realized they didn't have it until they needed it, right? And they were told by the insurance company, no, sorry, you're not covered. And these women then were going into debt $25,000, $30,000, depending on the complications of the delivery. So that was one reason. The other issue, though, that I want you to remember as we're following the debates, right, in terms of repealing Obamacare, is this rehabilitative and habilitative coverage. We also included that as one of the 10 essential health benefits. Why is that important? For those of you who work with disability groups, our disability groups were pushing, our veterans groups rather, were pushing for rehabilitative coverage, right? We have many returning veterans who are unable to access rehabilitative services. Our disability groups were pushing for habilitative coverage. It's a little more controversial. So this is where you may have someone, you have a child who was born without the ability to use maybe a cognitive function or maybe unable to lift their arms, move, etc. The therapist would work with these children to give them or help them achieve some function that they never had. And it was a very controversial area because even though the US Supreme Court in the early 1980s wanted to find a right, a limited right to habilitative coverage, they just couldn't get their arms wrapped around it. So from that time until the ACA, it was a very contentious, very difficult issue to get policymakers to advance. So let me actually just, in my 8 minutes that's left, we talked about these 62 provisions. They are scattered throughout the entire ACA. Again, we wanted to make sure that there were incentives for providers to develop health equity-related programs in their communities. We wanted to make sure that navigators who are going out and assisting people, enrolling them in the health insurance exchanges, that they understood the unique needs, the barriers, the challenges for folks who may, for generations, were not able to access health coverage, healthcare access. And we wanted to make sure that notices were done so in a culturally and linguistically appropriate manner. We also pushed for data collection and reporting, because if we have the data, we know there is a problem. And opponents have continued to push back, trying to strip out the data collection piece. No data, no problem, right? And as you've heard, that is so critical in this movement. Comparative effectiveness research. For those of you who work in this space, we wanted to make sure that the discoveries that are realized in the lab are translated into every single community. And I'll give you an example of why this was so important to us. For those of you who work in women's health, what we recognized was that many women with disabilities, the medical equipment wasn't accessible to them, right? So we wanted to push for increased research. We wanted to mandate that providers and others actually, and medical device manufacturers, were more inclusive in their clinical trials. Because the death rates for women who were wheelchair-bound were significantly higher than the rest of the population. But then what we also recognized was that while there was no real disparity in terms of breast cancer screening among women, whether you're white, black, Hispanic, Asian, etc., we recognized that the death rates for black women were significantly higher. Why? What was going on there? Well, black women tend to have the deadliest form of breast cancer, triple-negative breast cancer. They tend to have more dense breasts. And what was going on was these machines, mammography machines, weren't penetrating and catching that more cancerous tissue, right? And so we wanted then to push these medical device manufacturers to recognize this is an issue that is occurring, and if you truly want to achieve health equity and be more inclusive, we've got to start looking at this stuff. Anyway, there are other prevention public health fund, non-discrimination provisions that were included in this law. Again, this ACA is not only a health law, but it is a major civil rights law. And we're going to see why that is, right? There are also 7 strategies that were included to hold the Obama administration accountable, to hold the U.S. Department of Health and Human Services accountable when they were implementing the law. Now, we are marching towards health equity, but the struggle still continues, right? Chief Justice John Roberts, who I actually highly respect, because he did follow precedent. While we were there nervously waiting, would this court, actually follow precedent where they had never before struck down a health law, but they had struck down a civil rights law, an 1875 civil rights law that the 1964 Civil Rights Act is modeled after? Would he strike this law down based on that precedent? Well, he actually, as we know, upheld the law. And this is one of the reasons why I sing his praises, because I think that he was fair and he did follow precedent. But here's what he did. So he says, members of this court are vested with the authority to interpret the law. We possess neither the expertise nor the prerogative to make policy judgments. Those decisions are entrusted to our nation's elected leaders, who can be thrown out of office if the people disagree with them. It is not our job to protect the people from the consequences of their political choices. And he again emphasized that in the second major Supreme Court case, right? Saying, don't come to the courts. This is a policy issue. You need to take it into the political process if you're not happy. We know that the ACA has, for the first time, increased the number of insured individuals, reduced the uninsurance rate to its lowest. It was at 8.6% in 2016. Right after the election, it jumped when Obama left office to 8.8. And my understanding today, because ASPE is not sending out those numbers, is that now over 4 million people have become uninsured again due to all that's been happening. In case you're a wonky person like me and you like to see the overall picture, from the time we've been collecting data until today on the uninsurance rate, you'll notice that with Medicare and Medicaid, we dropped from 24% to about 14% in the uninsurance rate, and when we expanded Medicare and Medicaid to people with disabilities, it dropped further. But notice that right up to the point when the ACA was being negotiated, it had reached its highest peak in over 5 decades. So where are we today? We know that there have been 10 brushes with death that the ACA has come up against. This time period that we're in is the 11th and probably the most fatal brush with death, right? It's the one that's putting the ACA in extreme peril. But for me, I think what has helped to lower my anxiety is the fact that President Trump admitted, who knew healthcare could be so complicated, right? And that was intentional with the complication, because if you take a scalpel to even one part of this law, you can disrupt other pieces, right? Here's why I wasn't as nervous when everybody else was saying, oh my God, President Trump says he wants to abolish the ACA. He wants to shred it to pieces. I said, well, it's going to be a little difficult because the ACA is a comprehensive and reticulated law, and its tentacles reach not only into ARA, so it reaches into the stimulus law that was bipartisan, but then it also reaches into 2 other bipartisan pieces of legislation. We were wondering now, after most of the ACA's provisions were going to sunset, what are we going to do in 2015 when they're sunsetting? Republicans control Congress, Obama's still in the White House, what's going to happen? Well, imagine my surprise when Republicans actually not only reauthorized all of these provisions in the ACA, strengthening the health equity provisions, but they actually expanded the delivery and payment system reforms, right? And then from there, with the 21st Century Cures Act, we took that opportunity to put in additional mental health reforms that we were not able to achieve with those other pieces of bills. So I wasn't too concerned because of this issue. It's too difficult to unravel. That's not to say that with the health insurance pieces that the administration cannot do that. So how many lives does Obamacare have? Anybody want to venture a guess? How many lives? The answer is more lives than a cat. More lives than a cat, right? And so as we are moving forward, there have been attempts to repeal and modify provisions. As of today, there have been 18 successful attempts. You get a partial listing of what they've been going after. We, of course, have been fighting to prevent further elimination of those provisions that we care deeply about. Now, today we really are at a critical junction, right? One that will determine whether we move forward with a more patient-centered, family-centered, equitable, and inclusive health system, or one that takes us backwards to a period of increasing health disparities. You know, every second is critical in this movement to advance health equity. If you haven't noticed now, we're living in a period similar to 150 years ago where advocates lost the political will to push back on attempts to dismantle health equity. We now have an opportunity with the ACA, with other health equity policies, to say, listen, we don't want to repeat the same mistake that took place 150 years ago. And I wanted to leave you with this poem by Dr. Benjamin E. Mays, an illustrious educator, the former president of Morehouse College, who in his tenure would actually present this to many of his students. He says, "I've only just a minute, only 60 seconds in it. Forced upon me, can't refuse it, didn't seek it, didn't choose it, but it's up to me to use it. I must suffer if I lose it, give an account if I abuse it. Just a tiny little minute, but eternity is in it." How true is that for individuals with behavioral health challenges today, right? Who have been struggling for generations to get equity in behavioral health. As one of our former presidents reminded us, he says, "Our destiny is not written for us, it's written by us." And I look forward to writing that next chapter with you all to increase health equity, not only here in the state of Colorado, but beyond nationally. Thank you all so much for the work that you're doing.
All right. That was an amazing walk through history. Daniel, your thoughtfulness and your insights about what's happened over the past 150 years really do help, I think, inform the health policy conversations that we're engaged in today.
Yes.
I do just want to mention before we spend a little time in Q&A that there was a slight smell of smoke in the room earlier. A couple folks noted it. The team here at Keystone is on it, minor issue, and they're making some changes, so it should be getting better if it hasn't already. All right, so full disclosure, Daniel and I got to spend a little time this morning chatting, engaging in conversation, and I know that he had to cut a few slides out of his presentation in order to make it work for the time that we had available. So I asked him, what did you not get to present that you really wanted to talk about? And I know one of the things you mentioned was, a feature of the ACA is delivery system and payment reforms.
Yes.
What implications, how did those intersect or have the potential to advance equity within behavioral health? And what are what's the promise and what's the peril of the delivery system and payment reforms as they're being implemented?
Yeah, I really appreciate that question because if you recall, there were 5 principles girding the ACA, health equity principles, right? One of them looked at that issue of quality improvement, right? And we were concerned, based on studies that have been produced by Rand Corporation and others, that showed that as we increase quality, what often happens is that we tend to exacerbate the disparities, right? And AHRQ, the Agency for Healthcare Research and Quality, the Institute of Medicine, now the National Academy of Medicine, also have raised that concern, saying as we are developing these delivery and payment system reforms, we need to be mindful that that has happened. And so just to put it in context, if you look at the map of the United States, the states that tend to have the highest quality scores in the country tend to be in the Northeast and Midwest. Colorado, you all are doing fantastic in that respect, right, compared to other states. But then the southern states, they tend to have the lowest quality scores in the country. But then when you look at disparities now, based on race or ethnicity, et cetera, those same Northeast and Midwest states tend to have the highest disparities in care. that care, that quality care, isn't translating to racial and ethnic minority populations. And in the South, there really isn't that much of a difference, a variation in terms of the care, because, as HRQ said to me, everyone is already receiving crappy care, whether you're white, black, Hispanic, whatever, right? So what we have been doing with the Obama administration and now with the Trump administration, with CMS in particular, is to help them remember or recognize that as you are developing these delivery and payment system reforms, as you're really trying to refine value-based purchasing, et cetera, that you understand that we need to take an equity lens to this work, to this effort. Because if not, we will continue to see these disparities exacerbated. So that's been an issue for us. One that, as we're moving towards health system transformation on that piece, we are educating folks about this particular issue, because we don't want to see what happened in the Northeast and Midwest happen to us in the South as we're increasing our quality.
So you took us on a journey through history, kind of telling us a story of kind of a step forward, a step back, a step forward, a step back. Where do you see us 50 years from now in this journey toward better health for Americans, improved health equity? Where will we be 50 years from now based on what you've learned from your look back in history?
So we talked about me being a glass half full kind of person, and I am hopeful, based on what I have seen now, with the pushback against, eliminating this health reform law, that if we continue to push back on those attempts and we continue to prioritize health equity, I think, and this is where it's very important, with the generals and the admirals, they came out in 2014 again with another study showing that 71% of young people, 17 to 24, were unfit for military service. As demographics are changing, right? As racial and ethnic minorities continue to increase their numbers, and we know that when it comes to racial and ethnic minority children, they tend to have lower access to behavioral health services. In fact, only 13% usually have access to behavioral health services. And usually when they get that service, it's of an inferior quality, right? We have a lot to do there. So with this prioritization of health equity, taking an equity lens to our work, with protecting these reforms that we have realized over the last how many decades, I think that the discoveries in science and in medicine and technology, I think that they will translate to these other groups, and I think it's going to make us so much better as a nation, a stronger nation together moving forward. So that's how I see 50 years from now. Yep.
So you are in front of an audience that includes a lot of folks dedicated to working on health equity, behavioral health issues, healthcare access issues, and policymakers at the state and local level. So as given your perspective on federal health policy, what would you say to the state and local policymakers in the room about the role they play in advancing health equity, particularly in the behavioral health space?
I really like that question too, because the states have been the incubators for a lot of these health equity provisions, these policies that we've been pushing. You heard me talk about Colorado helping us to stay at the table based on that diabetes disparity study. I think that for folks here in the state, be bold. I think Colorado is a bold state, right, in terms of pushing this health equity agenda. And I think that you will all continue to be a leader in this space, and we can then all benefit as a nation from what's happening here locally, right? And we can use that to scale up policies like what Mrs. Carter tried to do when she was First Lady, and now what we try to do with Colorado and California with the ACA, et cetera. So that would be my advice. Continue doing what you're doing, be bold, not be afraid, keep pushing this needle. And I really liked when Karen talked about making sure that, we are inclusive of the groups that haven't always had that power and privilege, right? And I think community engagement is key if we're going to really affect health equity in the future, create the changes that are necessary. We need community engagement, and we need to ensure that we are inclusive as possible with these groups.
That's great. So we're running little short on time, so I'm going to ask one final question, which is just tell us what inspired you to take, you were clearly very steeped in federal policy, really in the weeds of the development of so many important pieces of legislation. What inspired you to take a look back and to really immerse yourself in the history of policy and legislation that affects health and health equity in this country?
So it stems from my own personal experiences. So I am actually from Nebraska. I am biracial, had a white mommy, black daddy. And I noticed that, in terms of my white family and my black family, it was always interesting to see how my white family, they lived into their 90s, right? And the black side of my family, they were lucky if they lived into their late 60s, let's say. And I thought, gee, when you started peeling the onion back, right, I realized that my dad was having issues in terms of finding employment. He was an insurance agent, an independent insurance agent. That's the way that he could find employment for his family, to care for us, right? And so he was out there making commissions, he's pushing, but he never had employer-sponsored coverage. And because he had high blood pressure and borderline diabetes, he was excluded from insurance coverage, even though he was selling that insurance to his clients, right? How unfair is that? That he was locked out and now he could absolutely go bankrupt because of that. So those were key things that motivated me to keep looking. And as we were, looking at the factors, as we look at the social determinants of health, we look at environmental determinants, they're all multiple intersecting determinants. But what I came to realize is that, undergirding all of these determinants are political actions or inactions that impact all of us, right? That we're not aware of. And after law school, I got an opportunity to work with Congresswoman Donna Christensen, who was the first female physician member of Congress, very passionate about health equity. She and I talked about ideas, and we took this multidisciplinary approach. You bring in the lawyers, you bring in the public health folks, the nurses, the docs, everyone. Let's brainstorm about what's possible. And when I asked key questions of folks saying, well, what has been tried and tested? What arguments resonated in the past that we might be able to leverage, in terms of the bills that we're working on? Nobody had an answer for me. Then I left to go and work for Senator Ted Kennedy on the Health Committee, right? And again, when I asked these questions, what have we done relative to this issue of health equity? What has worked in the past? What hasn't? And so I had to go and research on my own because no one knew, right? We're really making policy unaware of what had been tried and tested in the past. And that was problematic. And I think, when I actually got to the Denver airport, I saw a poster saying that if we're going to make history, we got to learn history. And I totally agree with that concept. If we're going to make policy, we have to know what has been tried and tested. And so that was the catalyst for me, studying as much as I can the external forces, the internal forces, the strategies, the tactics, the arguments, what resonated, what didn't, what could we then take and use moving forward. And there's this whole piece that I have that I'm working on right now. But, the national security argument was one that resonated, as you saw, with a Democratic administration and now with the Trump administration. So that is, to me, very important that you understand what has resonated, what can we use to bolster the argument.
Well, thank you, because I think we all benefited from your work to really look back and understand the history of the issues that we are all here working on. So thank you so much for joining us here today, Daniel. Thank you for sharing your insights with us. It was a great way to kick off the symposium.
Thank you so much.
Please join me in thanking Daniel.
Thank you, Amy.